All right, we are live at 7 o'clock Eastern Time for our mental health unscripted conversation where we talk about various mental health stuff. Um, Gosh, I hope I'm connected. It says here something about not being connected to the chat. Testing. Let me see if that works. Successfully connected. Okay, should be okay. So what we do here is we talk about mental health every week at 7 o'clock. I wasn't here last week because it was Easter and it was a little hectic. And it's posted later, but if you show up 7 o'clock Eastern time, you can ask chat questions. So feel free to ask any question that is mentally health related, even if it's only vaguely mentally health related. We try not to get too controversial or political here, but we are just supporting each other and talking about mental health stuff. So with that said, I don't necessarily call out everybody who shows up on the chat, trying to keep as much confidentiality as possible. But I also cannot promise any anonymity because it obviously is an online thing. We are posting this online, which before we get started, I just have to say this is the coolest shirt ever. I just got this shirt today. I have another one that's similar, but it is the Alpha Male shirt with all this cuteness, and the clash of symbols is beautiful, and I love it so much. And I've got my beautiful little princess right there to the side of me. Hi there, Angel. So, anyway, just gotta brag there for a little bit. But anyway, I love the whole alpha male thing. So I'm going to start on that topic. Might as well. But anything that anybody wants to chat about, feel free to ask questions, even if it's unrelated to what we're talking about. I really set that as a priority, and I really like getting the questions. So don't stop believing. Don't not ask a question just because you are like, oh, we're not really on that topic or something like that. If you have a mental health related question, feel free to chat about it. Okay, so alpha male stuff. I am going to be real here and share my opinion on some stuff. And it's okay if people have different opinions on things. But I grew up in a athletic family. My dad was a national champion wrestler. And so we were competitive in a sense. Now, I do think that my dad did a pretty good job trying to make it about self-growth. I do love sports, but it's a love-hate thing because the problem with sports is it presents a worldview, even if it's not trying to, that is win-lose, right? There's one top of the podium, and then from there it gets lower. How much have you looked into cat psychology? That's a great question. All right. So I've looked a lot into cat psychology. It's one of my favorite topics for obvious reasons. So, well, and actually alpha male, when I was getting to there with the is a wolf thing, right? But it's somewhat related because we have a misunderstanding on what it means to be an alpha, because actually the alpha wolf is the one that goes behind, not in front. The original study about the alpha was a misunderstanding of wolves. And actually the strongest wolf is the one who makes sure no wolf gets left behind. But yeah, I watch videos and do research on different cat behavior to try to best understand Ripley. And I do think I have a pretty good understanding of what cats are trying to signal to you. I am a little bit of a cat whisperer, and I'm not perfect in predicting cats' behavior and being able to get any cat to love me, but give it enough time, I'm pretty good at that. to answer that question. So feel free to follow up on anything cat related as well. Mental health and cats. What could be better? Okay, so back to the men and women energy, athletics, sports, competitiveness. Um, he tried to focus on self-growth a lot. And I definitely saw some men that I really admired in that high-performing athletic realm that I did also see a lot of ego in. And Michael Jordan once said in a documentary about the ego as necessary for accomplishments at the highest level. And I think that says a lot about the way he achieved. But then I started thinking about it, and the area, I don't know a lot about sports in general, but in terms of like competition, or I mean, combat, I do know a fair amount. And if you look at different combat realms, you'll see very different champions that are motivated by very different things. So, like, for instance, there's the GSP, who's like George St. Pierre, maybe one of the, if not the GOAT of all time in MMA, not filled with ego, right? All about trying to be the best artist, martial artist, best performer, working on his craft, but not from a sense of self. John Jones, very different story. Mike Tyson, Muhammad Ali, very obviously egocentric in his perspective. But then you look at like Khabib, not very egocentric in his perspective. So this sense of pride and pushing is really not, sorry, I'm not asking questions. I just like the tangent you're on. Okay. This pride and pushing is something that can create achievement, but doesn't necessarily is not necessary for achievement. And this brings me to this, as somebody who does a lot of crazy stuff, that does a lot of athletics, that does a lot of things. Everyone was like, oh, David Goggins, you got to listen to this David Goggins guy. And they put me on this book. The first book, I think, is something like You Can't Hurt Me, which I find already very revealing as a therapist. And then there's another book. I can't remember which one's which, but I listened to one of the books while I was running, which I thought was pretty appropriate because he's a long distance runner. And he does talk about going to therapy at a certain point, but very briefly. And I'm just going to be honest with my opinion on it. I think he was too scared to actually deal with the inner demons, to deal with himself, to be a fully healthy person. And in the book, at a certain point, you see as his body is breaking down from all this running that he's doing in avoidance of therapy and avoidance of emotions, in my opinion, he had a mental breakdown. Like he's not, I'm not saying that he's not someone you can admire things about, but at the core, that's not a strong man. At the core, a strong man is one that can face their emotions, that can feel the connections. The alpha male cat, cuddler, right? Somebody who can cry, somebody who can be present, someone that can go through those things is, to me, the higher measure of a man. And I don't want to say even just to me, if we go evidence-based, we are going to see it echo in the same way, that you're going to see the most stable in their relationships, in their accomplishments, stable in their accomplishments. Now, this is where there's a little bit of an asterisk. See, in today's society, because the way fame works, we can sometimes overly credit people that have specialized, that might not be very good, complete, whole, healthy human beings, but they have one talent that is really impressive. And I'm not saying there's anything wrong with admiring that talent, but understand that that can come at a huge cost if you don't balance that and aren't at peace with who you are internally. And it's like, ultimately, what would you rather have? This super big fame from an accomplishment that will eventually fade away, or that stability and comfortability with yourself, where you know who you are and you're at peace with you? You could talk some about exposure therapy and balance, and like if people are like forced to be exposed to things, how it affects the process. Yeah. So my go-to on that is the frog metaphor. So if somebody is afraid of frogs and I throw frogs in their hair, are they likely going to be more afraid of frogs or less afraid of frogs? The answer is more afraid of frogs. So exposure does not equal a diminish of a phobia. If we have a phobia and then we're exposed to that thing, it actually increases. This is where there's this other ingredient that is absolutely necessary called willingness. Now, if I take a couple willingness and progression, then those two tools together can free you from any phobia. So if I take the same person who's just as afraid of frogs, but she's willing, or he's willing, to address that fear of frogs, and we slowly work with them instead of jumping to the throwing the hair frog in the hair, we gradually introduce first the idea of the frog. Now, the very idea of the frog might cause anxiety at first, and that's great. That's actually what we want. We want a mild anxiety rise. We want the anxiety to grow and the anxiety to fall. And then we increase the stimulus. So then we're going to like have the frog in the room with them, but like in a cage, so that it's like not going to attack them or something, because, frogs are very violent, obviously. And then we watch it. It grows, it shrinks. Eventually they become bored. They're ready to move to the next phase. Then we increase it the more. And we keep on going until, yes, we can put a frog in that client's hair and they will be less afraid of that frog, not more, till they feel very comfortable. And there's really no level to that. And this can work with anything. This can work with being afraid of being alone. This can work with being afraid of large crowds. This can work with even, it gets harder when it's like intangible fears, like a fear of embarrassment. Like you can create scenarios in which you're mildly embarrassed, but it becomes harder to control. It's really hard to do with attachment stuff. So like, it's really hard to have a mild boyfriend or girlfriend that's like just a progressive boyfriend girl. I mean, like in some ways the relationships are naturally progressive. We meet someone, then we get closer, and then eventually, maybe husband and wife kind of thing. But it's not as controllable, the rate of progression. So it's hard when you're scared of attachment to do this kind of exposure therapy kind of stuff in a very intentional, scientific way. But it does make a huge difference, and it can help people progress. You need willingness and you need progressive overload. So slightly increasing how intense things are over time. What is my favorite food? I don't know why that's a mental health question, but I would say it's usually seafood. If I see food, I like to eat it. I like crab legs and stuff like that. Frogs relieve themselves when they are afraid. Not good for the hair. Good point, right? And, it's like, so kind of gets me to a topic of called disgust intolerance, or disgust tolerance, which is another very interesting psychological thing to me that like not a lot of people know about. Hitler had a very low disgust tolerance, so he was disgusted by a lot. Disgust is one of the primary emotions. It's one that doesn't get talked about as much. So like sadness, anger, happiness, those kind of things get talked about all the time. Disgust is one of those. And it's meant as a protective mechanism. So like you see something, you go, because it won't be healthy to be around it or eat it, or, that's why certain smells are just instinctual survival to try to tell us that we could be in danger and we shouldn't eat something that smells really bad, that kind of thing. But with people that become hypersensitive, ooh, I got a like. Thank you for whoever liked the video. People that become hypersensitive to disgust become more and more closed-minded. They get that trigger like there's something dangerous, the trigger of like, oh no, that's gross, that's bad, right? Sometimes even when they just see people functioning in a different way than they would do it. So open-mindedness is kind of the reverse of disgust intolerance. So someone that has a low disgust tolerance, so they don't handle disgusting well, is very closed-minded. Someone who's very open-minded will usually have a higher disgust tolerance. So you can see somebody doing something very different from the way you would do things culturally, and you go, that's really fascinating. That's really interesting. I'd love to know more about that. I'd love to experience this. So travelers are usually people that have lower disgust tolerances, so they look at, so OCD, this relates to exposure therapy, because for people that have obsessive compulsive disorder, exposure therapies are very effective treatment because they've been hurt before, because they will react and they feel chaos is dangerous. So disgust, right? It's disgust based. They are trying to keep everything in this order, trying to keep everything in control. I talked a little bit 2 weeks ago about the obsessive compulsive. Did I lock my door? Did I not lock my door? I'm going to check it. I'm going to check it. Did I check it? I checked it. Right. And how when we do that over and over, we end up reinforcing those behaviors. So the fear becomes bigger and bigger, and eventually it takes us over. And that's how we become obsessed with a compulsion. Right. So obsessive compulsive disorder is I have an urge, and because I give it so much psychological attention, it increases. Oh, I got another like. Thank you. So the more even mental energy you give an obsession, compulsion, I mean, the more you will become obsessed with it. So if this is why it doesn't work to make your life about not doing anything, right? So if you make your life about not worrying, you're going to be stuck in worry forever. If you make your life about not doing drugs, you're going to be struggling with doing drugs forever. You're going to relapse all the time. You have to make your life about something bigger, so you don't become obsessed about it. You have to let the compulsion come and let the compulsion go so you can move forward. What percentage of your clients are willing to do the work to change? So ongoingly, the clients that keep coming back, obviously, there's a reason that they keep coming back. Now, there are some clients that their rate of progression is pretty slow. So I think of the clients that keep coming back, all of them are willing to do at least some work, or they wouldn't keep coming back. There are ones that like literally in the first session, it's obvious, even to them, that I can help them, and then they stop coming back because they're afraid. They don't want to deal with it yet. And I say yet because I still have hope that eventually they will find the time. They will be in a good place and they will be ready to deal with it at a certain point. And maybe they'll come back to me. Maybe they'll go to another therapist. It's totally fine either way, but they will go to therapy and they'll work on the stuff. I lost audio. Did anybody else lose audio? Hopefully you can all hear me. I did have a weird thing about chat disconnected earlier that I've never had before. So hopefully I am still online. Let me make sure I'm connected to the right internet. I am. So let anybody else let me know. Audio fine. Okay. So it might have just been that one person. So what was I saying? The willingness for the clients. I had somebody, even as a client who was like, I'd be willing to do anything for this certain thing. And then that was right after they were like, no, I can't. I'm not going to do that because that's too hard. And it's like, oh, because you said that you're willing to do anything, but you just refuse to do something that's too hard, right? So I think willingness is in some ways a spectrum. And I think people that go to therapy are at least willing to do something and we'll take it, right? So in therapy, nothing is a forced march. And if people have different attitudes about this, like even with like ice bath therapy, which is something that I really do think is very powerful. I don't push people into it. If people are like, I don't know, maybe I'll try it, I'm going to say, hey, take your time, think about it, make sure it's something that you really want to do. When you're ready, come and see me. Because if somebody is not mentally prepared, I mean, ice bath therapy is intense. And it's like, don't force yourself. If you're not there yet, you're not there yet. Trust yourself that you'll eventually get there. Keep contemplating the idea. So there's gosh, I need to learn the actual name of it and where it comes from, but there's stages of change. And one of the stages of change is pre-contemplation. So you're not even thinking about it yet, but you're, before you're thinking about it. And then there's the contemplation stage, and then there's preparation, and then finally there's action, right? Then maintenance, and then, possible relapse, and then you just go through it all again. Okay. All that to say, in the contemplation stage, that alone is powerful. That alone is worth it, right? If you're still in that contemplation stage on certain changes, like just keep thinking about it would be my main encouragement. Don't shove it away from your subconscious, or shove it into your subconscious, but keep it in your conscious mind. Keep the idea of, okay, there is this thing, and eventually I want to deal with it. I'm just not ready yet. That's okay. I've been there for some stuff. What are some strategies to deal with unexpected big life changes? I mean, it somewhat depends on what those big life changes are, because your preparation strategies are going to vary a lot per person and per what those big life changes may be. One very cool little thing is that fear and anxiety are chemically very similar to excitement. So that feeling of nervousness, the butterflies thing, this can go bad in certain situations, but it's something that is actually reframable. So you can take that fear, that nervousness that you're feeling, and reframe it as excitement. So we all know how much it works when somebody is super anxious and excited, just telling them to calm down. We all know that immediately they calm down. They don't get mad at us. They don't yell at us. They start breathing when hey, you need to breathe. They just go, oh, you're right. I forgot to breathe. Thank you. You're so helpful. Right? And that strategy always works. But in the off chance that they actually get mad at you, it's partly because trying to, like, literally there's chemicals in our brain with anxiety, like boom, it's there, it's in our minds, and it's actual matter, right? So when people say something like, oh, it's all just in your head, it's like they're saying it's all easily changeable. But we do this as therapists. We spend years working at helping people reframe the neurons in their brain to fire differently. Behavioral therapy, we reprogram those with operant conditioning, and it takes sometimes years depending on what we're talking about. So you can't just switch for a lot of things. So reframing from I'm super anxious and scared to I'm totally calm is very difficult. Reframing from I'm anxious and scared to I'm excited, I'm anticipating the possibilities is a much easier reframe. All of it is this, but in between every stimulus and response, there's a space. Learn to master that space, which is originally Kierkegaard who came up with that idea. The words are different depending on the quote, but the idea is another idea is slow down your processing and your thinking, and you'll have more room to help you come up with strategies. And there's a lot of ways to do it. Some people like to journal, meditate, visualize, but whatever it can to slow down your thinking so that you can start to process. When is ACT not the best choice? Well, I mean, exposure therapy is the best choice for people that have specific phobias, and that is a different form of therapy than ACT. If somebody is struggling with borderline personality disorder, I do think dialectical behavioral therapy, which is very similar to acceptance and commitment therapy. By the way, that's ACT, is acceptance and commitment therapy, is a better choice because it focuses more on emotional regulation and more on how to validate feelings, but not let yourself live in it. It also has a lot more attachment stuff than ACT does directly. ACT can apply for this thing. I don't think ACT is ever wrong, but like when you look at the evidence of different therapy strategies or different therapy techniques, there isn't really magic bullets. Okay. So like EMDR, for instance, is something that's like kind of got a gimmick to it. It is effective form of therapy. It works. Cognitive behavioral therapy works. EMDR works. Acceptance and commitment therapy works. For some people, when they go through EMDR, and so if you don't know, EMDR is eye movement, EMDR, desensitization reprocessing. And so there's like different, sometimes it's like where you look at these lights and they go back, some it's tapping, right? But you've got these different strategies they have different ideas of why it works. I think it really just distracts you from the thing. And then you go through these visualization exercises. It's a very specific method of therapy. For some people, they feel like they did something, right? For some people, when you're going through like acceptance and commitment therapy, they just think of it as like talk therapy. And it is hard for them to just trust the process. So the placebo effect is powerful. When you think something is going to work, when you're confident you're doing something, that sets you up for success. So that's the other reason I would say ACT is not the best choice for somebody who doesn't believe in ACT. If you don't think acceptance and commitment therapy is that great and powerful, then you're wasting your time doing it. If you do see that it's got potential, I think ACT is probably more tools and easier applied for most people. Because it's got these strategies that are very specific. There's other forms of therapy like Jungian psychology that is very effective for people that have a very high IQ and not very effective for people that don't, because it's so complicated, where acceptance and commitment therapy are far more simple. I'm thankful for the small wins. That's huge. It's just celebrating each win. I tell people sometimes that if they treated themselves more like a baby and like really celebrate it, specifically like a baby that's like being potty trained, that would be huge. Or in this one video, there was a therapist that it was a funny reel, but there's a therapist that was like, treat yourself like your best friend. And they're like, I don't know if that's going to work. And it's like, treat yourself like you treat your dog. And they're like, that might work. Because it's like they're with the dog, they're like, you're just so precious and everything you do is perfect. Like I would say, but Ripley. Yeah. It's like everything, you're so cute and wonderful, and I love you so much, and everything you do is great. And if you just start talking with yourself like that, that makes a big difference. When something doesn't trigger me the way it would have in the past or how I would expect it to, small growth is still growth. Yeah, absolutely. And you know, the way growth works, it's actually like up and down. Like growth is not linear, but it's like so much of the time. Let me see how I do this in the camera, right? There's a big process that's like this, and then it starts going like that, right? And then it kind of starts to level off again, right? But when you're in this phase, as you're starting to grow and you feel like there's very little progress, a lot of people give up. And it's really sad because sometimes I can tell they're giving up right before they get to this phase. All right. Or to go back to how many my clients have willingness, there are a lot of my clients that will get, from here to here in their self-growth, but they get through the crisis that put them into therapy, and then they'll stop going. And it's so sad to me because it's almost like, okay, you know, they're probably not done because they haven't worked on all the inner stuff necessary to really be the best version of themselves that they can be. And when they do that, man, there's so much freedom. It's so powerful. Would EMDR be appropriate for someone with a low IQ or intellectual disabilities? I would imagine that it depends, obviously, but there are probably people that specialize in EMDR for certain populations like that. But I don't think it would be necessary, honestly, because, like, again, my theory, there's debate about why EMDR works. And my theory is that there are certain topics that are really hard for people to talk about. And this tapping or eye movement distracts them enough that they can go to these memories and process through these traumas. And so people that have those disabilities usually don't have the same resistance to talking about things. When they don't talk about something, it's usually because they can't understand it, not they're not willing to. It's one of the things about, like, some people love working with people that have mental disabilities just because they know they're not fake, they're genuine, right? Because they don't have that resistance to the experience. But again, I could be wrong on that. That is definitely not a topic that I am an expert on. Why don't you clap when I walk? Yeah. So that's a reference to something that I had said before about watching. I didn't know that it was the child's first steps. I felt a little bad afterwards, but I watched this child walking, and it was, young child, and they were walking not great. Like, they were stumbling around, like, and I'm like, I walk every day. Nobody claps for me. Right. And it was this joke, obviously, but, like, the idea there is that, man, we should really celebrate our wins, even if they're small. And it's like, watch if you start to talk to yourself in a really positive way. And even when you see the self-critic, because the self-critic is there for pretty much everyone, they are going to show up, that self-critic. They're going to say some stuff. And if you start being nice, even to the self-critic, because that's what people try. People are like, I'm going to be nice to myself. And then the self-critic goes, you can't be nice to yourself. You're stupid. And then we try to insult the self-critic, thinking that's going to get us into a positive state, mind state. It doesn't work, right? It's like, I'm not stupid. You're stupid, self-critic, Dang, I'm so stupid for being a self-critic, right? So whatever. It's like, it's just a vicious cycle, and we're in a negative feedback loop, right? We got to get out of the negative feedback loop. So to get out of the negative feedback loop, we got to start being positive to ourselves. We got to be like, oh, inner critic, I hear you. You're calling me stupid because you want me to improve. I understand. I trust you. I love you. Let me give you a big hug, you big, meanie. All right. But I could really use us being a little more gentle in our approach. Oh, okay. It's like that kind of thing. If that makes sense. Right. We want to work with our mind, not against it. And remember, the goal, one of the goals intellectually is integration, right? So we're at peace with ourselves. And if we are dividing these parts, criticizing ourselves, if you're criticizing yourself, you can never be complete, right? You can never be whole. You got to celebrate the little wins, celebrate. And it's like, look, therapy's hard. Going through this stuff, there's a reason, right? That people need a professional often to go with them for stuff again and again, because having somebody with you to just help you and guide you in the process and encourage you, be your cheerleader, and remind you how tough it was. When I went to therapy first, so my therapist was not brilliant. I mean, I'm not trying to criticize them, but, like, there were some things that they did that weren't great therapy, they really helped me. They really helped me. And the main thing that they did that helped me more than anything else was reminding me how difficult what I had gone through really was. Like, if they had just done that, that would be, I love the little self-critic talk. Thanks. I love you, little self-critic. Yeah, you gotta love the little self-critic talk. But anyway, um, what you went through sucks. What you went through was really hard. Be patient with yourself. Give yourself more time. You're doing okay. It's going to be okay. These messages that might seem generic and they might seem obvious, man, it helped to have another human being say it as I was going through the emotional processing, as I was actually dealing with the stuff. Because that's the hard part, is like the temptation is for us to not deal with this stuff. And we can fall into denial and think that we're going to get better without ever dealing with this stuff. And I mean, like, going all the way back to the one person's questions about my clients and willingness, it's like, we can still make progress if you're not willing to do hard things. We can still help, right? But the change that we're making is incremental rather than exponential, right? Incremental changes come from positive work. Exponential or growth comes from being willing to deal with the inner demons, the inner struggles, the worst traumas, to talk about the experiences that are really hard, to do whatever tools, right? If your willingness is all the way, right, up to 11, right, past 10, 11 is louder than 10, right? Then you are going to have exponential growth. But if your willingness is at 1 or 2, you still have incremental growth. I feel like that's why CPR works. Sometimes just talking out loud makes you realize how silly some things sound or how toxic or whatever. Yeah. So for those in the chat that might not know, CPR is a tool that we teach at a church that I'm involved with called Christ-like Positive Regard. It's very similar to client-centered therapy, where the biggest thing you're doing is just positive encouragement, listening, helping the person feel heard and seen, but also this reminding them who they are at their best is one of the biggest part of that tools. And man, if you can have somebody, like, if you want to help somebody, reminding them who they are at their best on a regular basis is one of the best tools. You don't have to address the negative behavior that they're living in. You just have to remind them who they really are at their best. And that makes such a big difference. It is so helpful to have someone else validate how painful what you were going through is. So true. That was a comment. And yeah, absolutely. We need it, right? We can become lost and feel so disconnected by pain if we feel invalidated. And that, I was like, we all make mistakes and all that process too. I remember telling somebody that they're crazy, and because they were, in my mind, reacting so disproportionately. And then this is before I was a therapist and before I understand the tools, before I was in therapy, before I understand the tool of therapy. I thought, part of our job was to correct people who are out of alignment with reality, right? You're out of touch with reality. Even in schizophrenia, proper therapy, evidence-based therapy that helps people in schizophrenia does not directly try to contradict their delusions, which almost every movie gets wrong too, by the way. You'll have like Sarah Connors in the Terminator movie that I watched recently, Terminator 2. And where like the therapists are all trying to convince her how stupid it is that she believes these things, that they are convinced are delusional. And that might have been the case at the time, to be fair. That's not proper therapy now, right? We know that actually does. So people double down on their delusions when you try to challenge it. And I mean, you can see this again and again. You can see this with people that don't have schizophrenia. You can see this with just basically anybody that, you get in an argument with them, and it's a heated argument. It's an argument that matters. Presenting them with evidence that they're wrong does not go make them go, oh yeah, well, I changed my perspective now. It makes them double down and get more angry, right? So instead, finding what you can validate. Now, you don't validate anything that's not true, but you find something that you can validate about what they're going through. They feel heard, they feel seen, and it starts grounding them into reality. And they start to attach naturally to real life more and more. Because the reason people fall into schizophrenia is usually because they're so disconnected, they're so hurt, they're so traumatized that their brain does it in protective mode. When they start to feel safe in reality again. And I mean, I had a friend that, like, one time I had this conversation with them, and I was like, they have fallen into full blown schizophrenia. Now, actually, technically, it was like be called schizoform disorder, right? Which is a little different than schizophrenia because it's briefer. But thankfully, it was very brief. They returned to sanity. I mean, but they were telling me stuff that just didn't happen. They were in a reality that is not, does not exist. That was only exists in their own mind. They were very disconnected. They were heartbroken. They were going through a lot of stuff. They had a mental breakdown. But then I saw them later, and they got back in touch with real life. Okay, where are we? It makes me think also of the ones who think they need to be strong through pain, but the second they are safe, all the feelings come out. Yeah, and like, suppression doesn't work. It just doesn't, right? Trying to push down all of this pain, thinking it's going to make it better, you're managing it, or you're toughing it out, or all this stuff like that. Going back to that alpha male thing, right? Oh, I'm a man. I want to toughen all my emotions and cram it into this little box until I just, cry myself to sleep, right? There's actually a thing that's on the rise called man keeping, where more and more men don't have friends. This is a problem, I think, universally, but men especially don't have friends. So they're not making real emotional connections. They are trying to be emotionally strong with their other friends, really emotionally numb, right? Not learning to regulate their emotions. So they don't share it with their friends, but then they get a girlfriend. And all of a sudden, guess what she gets? All of their trauma and emotional junk from like years, from like their whole life, and they're trying to and they just basically like, oh, you just keep all of this, girl, thank you, right? So the girl will get in this relationship with this guy that seems normal and sane and healthy, and has friendships that seem all stable, and and then all of a sudden all this trauma, and then she'll go, and I actually have more than one client, but one in particular that kept having this happen, right? She'll go, meow, oh, meow, you need some attention. She'll go have a relationship with these guys, and all of a sudden their emotional basket cases, and she'll be like, you need to go to therapy. And then they're like, I don't need a therapist. And it's like, I just need you to be there and take care of all my emotions. And it's like, well, that's not what I signed up for. I signed up to be in a romantic relationship where we, lean on each other, sure, but in a mutual way. If you need somebody that just bears all of your emotional baggage, that's what therapy's for. And actually, I mean, honestly, I don't bear everybody's emotional baggage. I help you get the tools to deal with it yourself. But I'm prepared for that, and that's what I'm there for, right? That's what a therapist is there for, not a romantic partner, right? And also, you need to have more than one person in your life that you're emotionally vulnerable with. But yeah, that's at least what made me think of the ones that need to be strong through pain, but then the second they feel safe in a romantic relationship, all of a sudden they turn into emotional basket cases and are just, crying all the time. And then the woman's like, "What did I do? I thought I got involved with the strong guy, and I got involved with this, guy who's really, you know, emotionally stunted, like a little child." Ripley is jealous of the chat taking your attention. Why is my daddy talking with no one? Well, no one is there but me. Yeah. Uh, but right now she is on her little couch. So she gave up on kind of getting my attention, and she's on her basically like her throne now. I got a little there was this tiny little scratch cardboard thing. It was a very like narrow thing that she started sitting on all the time, and I was like, okay, she wants to have some kind of a scratcher thing. So I got her a couch that is perfect for her, and I think I could show it to you guys here. So there she is on her couch, and it even like looks like a couch. It's got, it's cheap, it's just got like a little print thing, but she loves it. So that's one of the things I bought for her that she immediately went to, and spends a lot of time on that thing now. It's one of her favorite spots.